Tuberculosis, also known as TB, is a bacterial infection that primarily affects the lungs, but can also spread to other parts of the body. Despite being curable and preventable, TB remains one of the top 10 causes of death worldwide, killing around 1.5 million people each year. The bacteria responsible for TB, Mycobacterium tuberculosis, is spread through the air when an infected person coughs, sneezes, or talks. If the bacteria enter the body, they can multiply and cause damage to the lungs, as well as other organs. The most common symptoms of TB include a persistent cough, chest pain, coughing up blood or phlegm, weight loss, and fever. However, these symptoms can also be caused by other illnesses, so a proper diagnosis can only be made by a healthcare professional. TB is treated with a combination of antibiotics, which must be taken for at least 6 to 8 months. It is important to finish the full course of treatment to prevent the bacteria from becoming resistant to the medication. In addition to treatment, vaccination can also play a role in preventing TB. The Bacillus Calmette-Guérin (BCG) vaccine is widely used in many countries and offers some protection against severe forms of TB in children. Despite the availability of treatment and prevention methods, TB remains a significant global health threat. By learning more about the disease and taking action to support research and treatment efforts, we can work towards ending TB as a public health emergency. It is worth to note that some people with TB disease may have no symptoms. This is known as asymptomatic TB. These people may only have a positive TB test. Diagnosis of TB typically involves a combination of tests, including physical examination, chest X-ray, laboratory tests to detect TB bacteria in the sputum, interferon gamma release assays, IgRAs, to test for TB infection. If the TB is in other parts of the body, imaging tests and/or fluid, tissue sample may be taken to confirm the diagnosis. Treatment of TB typically involves a combination of antibiotics taken for at least 6 to 8 months. It is important to finish the full course of treatment to prevent the bacteria from becoming resistant to the medication. Prevention of TB includes vaccination with the Bacillus Calmette-Guérin (BCG) vaccine, and diagnosing and treating people with latent TB infection to prevent them from developing active TB disease. It is important to keep in mind that TB is a preventable and curable disease, and with appropriate diagnosis, treatment, and prevention efforts, the global TB epidemic can be brought under control. Thank you for watching this video. If you will like other health-related videos, please consider subscribing.